Cody Straits. I'm a student at the LISD Tech Center. I'm also a high school student at Clinton High School. Today I'm going to show you how to use an AED properly and run through the AED as well. So here's an AED. This is exactly what it looks like. It may look a little different in the field, but it should be pretty similar to this. So the first thing that I would do is I would open it up, and it will start to talk to you.
Call for help now.
So it's going to tell us to call for help right away. So I would call for help at that point. Before I would even open the AED or even go look for an AED, I want to check my patient to make sure that they are in what's called cardiac arrest, which is they're not breathing, they're not moving, their heart's not moving. So I would come up to my patient, I would make sure, look to see if their chest is rising. That would make sure that they're breathing. I would also check for a pulse at that point to see if I can feel a pulse for a full at least 5 seconds. So at that point, and I would also go down and listen for breath sounds as well. And if I don't hear any of that, then I would grab the AED. I would open it. Once again, it tells me to call for help.
Call for help now.
So then once it calls me I would call for help at that point. So then I would remove all the clothing from the patient's chest so it's bare. If the patient's chest has more hair on it, I would want to shave the patient, and usually a razor is located inside the AED. So what it's telling me to do is I want to pull the red handle, open the bag. Once the bag is open, it's telling me to get the pads out. And I'm going to look exactly at the pictures to where the pictures are telling me to look. So I'm going to peel my pad, and I'm going to apply it exactly where it tells me. And I'm going to do the same thing with the other pad.
Remove all clothing from patient's chest.
So at that time, it's going to begin to what's called monitor my patient, hopefully.
Pull red handle to open bag.
And then once it does that, it's going to monitor my patient and tell it, and it's going to either say shock advised or continue manual CPR. And at that time, either I would do manual CPR or it would shock the patient, and hopefully the patient responds to that shock. So it is very important that we get this AED applied as soon as possible for patients with even a heart attack. It could be a seizure. It could be even any type of internal bleeding that they have. It could be a stroke. Anytime that their heart stops or is just barely sitting there, the heart will kind of just shake sometimes. And that's when we want to apply the AED. That's what's called cardiac arrest. I'm Cody Straits from Clinton High School, and I'm a student at the LISD Tech Center, and that's how you properly use an AED.